I want to thank you all for giving me about 20-25 minutes this morning to give you a review of the state of the university, which will not be in the context over the last year, but will actually be the context of the last 2 years. And I want to begin by quoting Al Copy, who many of you recognize the name as the past president of PSENG, and who is currently the executive director of the Newark Alliance. Quoting Al, "You," that's UMDNJ, "have been blocking and tackling for 2 years. Now it's time to start running some plays." End quote. Let me paraphrase that. And my paraphrase of it, it is the end of the beginning. Now, what do I mean about what is ending? Many of you heard that about a month ago, the UMDNJ Board of Trustees authorized me to be the signatory for an agreement between the university and the Office of the Inspector General's Human Services. The agreement that I signed is called a Corporate Integrity Agreement. And it's an agreement between healthcare providers and the Office of the Inspector General that ensures fulfillment of our compliance obligations for future participation in healthcare programs from the federal government. If you've settled with the Department of Justice, you have to start and implement a corporate integrity agreement. Otherwise, you cannot bill Medicare nor Medicaid. Now, a CIA is not unique to UMDNJ. Ours is literally one of hundreds of CIAs that exist around the country. Hospital centers, global pharmaceutical companies, health insurers, individual healthcare providers have all entered into CIAs as a way of demonstrating their sound business practices and compliance in terms of billing. I want to underscore that the Corporate Integrity Agreement is in response to old violations. How old? Some of those going back to 1993. I also want to underscore that the changes that are mandated by the CIA, the great preponderance of those, are actually already in place in UMDNJ. Now, as you can imagine, at the time of the signing, the press approached me and did it in the usual way that the press tries to seek an emotional response. What does this mean for the university? And I think the response to the impact of those dark days in our past is very much influenced by the impact of those days on individuals. I had an old boss who used to correct me by saying, "Bill, there is no single reality. Perception is not reality. Perception is multiple realities." So I think there are multiple perspectives on the reality of the CIA and our past. On the other hand, I can tell you that I'm confident that there are some common perspectives because we had common travails in the past. And you folks participated. I can say with the fullest of confidence that the inappropriate and selfish behavior of a tiny group of people at the university tarnished the entire university and those people who were affiliated with the university. I can also say that we had a small group of individuals who selfishly fed their own self-interest. They worked alongside us. Some of them supervised us. Some of them went forth to represent the university as if they were us. But the reality is that most of this organization, when they looked in the mirror, did not see themselves as those individuals rightfully. I can also say as a common feature that bad behavior, low expectations, plain distractions routinely challenged all of us, as we say down to the South, that we were just weary to our bones. 2 years ago, we were a great institution that was in deep trouble. Don't let anyone tell you otherwise. Don't let anyone sugarcoat it. Don't let anyone try to present it in a soft and squishy way. We were at a moral precipice. We were threatened in terms of losing our ability to call ourselves even a school, least of all a university. There were many people some supporters, many detractors, who openly talked about correcting the institution by balkanizing it, breaking the institution up. We had a crisis ourselves, a crisis of self-doubt, that I would say was stoked by us believing what we read and what we heard. We were angry, shamed, sad. To use an overused term, the organization was truly at a tipping point. And I think it's fair to ask, what reasonable person 2.5 years ago would think that the university would come back from that precipice? So over the last 2 years, the staff, faculty, administration, reconstituted board of trustees, newly developed board of directors, yourselves, have worked hard to make the university a place that the public can now value with pride, that deserves recognition as a great statewide asset. So I think it's poignant that the university would neither shame, without hiding, without rebuke, enters into a corporate integrity agreement. For the corporate integrity agreement truly reflects the end of the beginning for this university. It is truly the closing of dark chapters of our past. I think the CIA is going to allow the university to externally validate how far we've come and to reinforce our expectations for ourselves and from others to achieve much higher than we have. There are operational and cultural enhancements that have been put in place. We've had to teach some people at one extreme, you know, your grandmother gave you some good advice, listen to it. And for others, it's reinforcement that you have been doing the right thing. I think the CIA is going to become an important component of our ongoing efforts and will be a measure of our accomplishments. I am here to reassure you that we are prepared to demonstrate internally and externally that UMDNJ is ready to assume its role as a highly ethical organization, compliant as a statewide asset with a bright future, ready to meet our students, patients, and the citizens in terms of their expectations. What I'm saying is that the university can and should stop speaking and lamenting about the past. As Al Copy said, and it is Bill Owen paraphrasing, it is the beginning of that end. And I think it's worthwhile in that context to look at where are we starting going forward with this new beginning. And I can tell you, I'm doggone proud of what this organization has achieved. Let's start with Jim Collins. Many of you have read his 2 books. If you've only read one, read both of them. In these, he talks about transforming an organization by getting the right people, quote, on the bus. I think that we now have so many right people in our organization that we probably need a couple of buses. So let me offer some examples to you. After an extensive national search, Drs. Tom Cavalieri, Sue Salmon, and Peter Amenta were identified as our permanent deans of our nationally renowned schools of osteopathic medicine, School of Nursing, and Robert Wood Johnson Medical School, respectively. I can tell you, these were not soft picks. They had tough competition, and these folks earned their role. If you read the Wall Street Journal, you probably have been following what has happened with the confectioner Cadbury. They've had some difficult times of late. In fact, they are trying to hold off a hostile takeover. I like to think that part of the challenge that Cadbury has is related to something we did, which is to say we poached away the chief financial officer from their North American, which is one of their highest performing divisions. That's David Miller, who now joins our organization as our first chief financial officer, who, working with Denise Mulkern as a comptroller, probably offer the finest finance organization of any university in the United States. want to talk about Diane Weathers, who just introduced herself to you. Diane's been with us just about a year to date, former editor-in-chief of Essence Magazine. I suspect you just got to see a wisp of her grace and her expertise and her content knowledge. She's leading our communications team, and so we'll be accelerating our success in external branding and information sharing within the organization. Kathy Van Camp, newly named Chief Ethics Officer. Chief Ethics Officer in this organization. A model of ethical reform that I can tell you I am receiving weekly unsolicited phone calls from university presidents around the country asking, can we mimic your model? She brings balance, compassion, and passion to her role. Now, many of you heard me describe the university as a school. In fact, you will recognize the suffix of virtually all of our components is school. And I tell you, what fine schools we have. The schools were, in fact, the highest performing unit during those dark days. Our applications are up. The quality of our applicants is up. Our entering student body, I can state categorically, is right now the tops in diversity in the United States of any non-HBCU. Depending upon how you count the numbers, we are the most diverse student body in the United States of any non-HBCU. Our students routinely score in the tops in the national averages for their standardized testing, and those students elect and are selected by the top universities for postgraduate training. But I'm also happy to share with you that we have a balance here, because the last thing you want to do is to train all your great people and then become a feeder for New York and Pennsylvania. In fact, I received a thank you note from the president of Pennsylvania first coming here, thanking us for our students and faculty. We have an increasing number of students that we're training who we are able to attract to programs in New Jersey. It's something that we rightfully should be proud of. I challenged our students several months ago to partner with us to improve their educational experiences, and the students responded. This summer, I was inspired by meeting with a group of student leaders who shared with me the charter for their newly formed Student Senate, as they described themselves a single voice of one formed from 8. What is the 8? The 8 schools spread across the state. I wish you could have heard them. It was inspiring to me. It was inspiring to my administration. I envy my faculty who have the opportunity to engage with our students at that level. The university's achievements have been recognized in Washington. I've received unsolicited congratulations from colleagues in Washington around us having not one, but 2 Fulbright scholars from the dental school. We have a Fulbright fellow from the School of Public Health. Compare that to other top-tier universities. For the first time, the University Hospital joined Robert Wood Johnson Hospital in being selected, quote, top hospitals in America, end quote, by U.S. News and World Report. All those people who are not on the list envy those who are on the list and say it's poppycock. Those who are on the list proudly laud it, and I'm proudly lauding what we've done. And by the way, we're one of the few universities in the United States to not just have 1, but to have 2 hospitals on the list. Broadway House, one of 15,000 nursing homes in America. 15,000 was one of only 41 that was selected for their honor roll. That's part of your university. The School of Osteopathic Medicine, again, was listed as one of the top 20 schools in America for geriatric training. There are hundreds of geriatric training programs throughout the United States, and SOM is in the top 20. We've innovations like the ABIACOR total replacement heart, the world's first completely self-contained, fully implantable artificial heart, the world's first artificial internal organ, was introduced this summer at Robert Wood Johnson Hospital. And even though the patient passed, his family wrote the most gracious thank you note. That's innovation. That's meeting our missions. So is it any wonder that over 60 of our faculty were listed in the best doctors in, no, not New Jersey, in New York? You've described a destination for healthcare. We have 20 top dentists that are from this institution. Just this morning, we celebrated our top doctors across our statewide system with over 100 doctors who were characterized by that designation. Something important to me, especially being a user of healthcare at this campus, talk about our food and nutrition department. They got into the act as well. We got the Silver Plate Award from the International Food Service Manufacturers Association. Now, why'd they only get silver? Well, they got beaten out by the Ritz-Carlton in San Francisco. They also got beaten out by Buffalo Wild Wings that my son tells me should have actually gotten first place. UMDNJ is committed to its mission of service for and with the community. And I think we have put our toe in the water in a pretty substantial way there. Let me give you a very simple example. This summer, we had our first wonderful open-air farmers market. That sounds like a trivial thing, but recognize, for much of Newark, poor nutrition is more plentiful than fresh produce. But there are some other things that we're doing. I'm pleased to make you one of the first groups to know that after years of waiting, a health and exercise facility is to be opened on this campus with the YMCA. And unlike many of our partner facilities and universities, it will be open to faculty, staff, students, and the Newark community. It's transferable membership to other YWCAs. Give you some other examples of community service. The University Behavioral Healthcare Organization has staff that volunteer their time for the Welcome Home program. For those of you who aren't aware of the Welcome Home program, let me tell you about it. Folks, we're at a war. And I don't know if you've noticed it, but many of the people who are participating, but not all in that war, kind of have the same kind of pigmentation as myself. Let me also tell you another ugly reality of this war. 1 out of 15 of our citizen soldiers come home so troubled, not from physical, but from mental injuries. They kill themselves. The suicide rate amongst our citizen soldiers right now is the highest of any demographic group in the U.S. The chairman of the Joint Chiefs of Staff was here 2 months ago, meeting with the Major General for the state of New Jersey. And he asked a simple query. New York, Pennsylvania, 1 out of 15 of our citizen soldiers take their lives. New Jersey, why is the percent 0? And the answer from the Major General was UMDNJ and programs like the Welcome Home Mental Risk Identification and Intervention Program. Mental health. Newark Housing Authority leadership and I met several weeks ago. And they proudly told me of their plans to create housing units for our psychiatric patients. It's not as many as we need, but it's certainly more than what we've got. Walk down the street, walk down South Orange, and see how many people you encounter who are troubled because of challenges that they have with their mental health and mental wellness. And they don't have a home. We're fixing that. UBHC also proudly has developed a new integrated healthcare center for their patients who are mentally ill. So not only are they addressing issues from the neck up, but issues from the neck down. And guess what, folks? We talk about holistic medicine, but we don't practice it very often. We treat the disease, we treat the organ, we don't treat the entire person. Treat their physical health, treat their mental health, get them a place to live, and guess what? They'll have a job as well, too. And we've got some plans there, which I'm not yet at liberty to tell you about, but we're working on. How did we get this paid for? We got it paid for by a remarkably large anonymous gift. I'm always impressed by people who do things where they do not take a claim for it. And let me talk about gifts. I want to give a shout out to the Goldstein family. Many of you know the Goldsteins, but I bet many of you don't know the Goldsteins. Where would you know the Goldsteins? The Goldsteins are the family that initially endowed the Valerie Fund. And why is the Valerie Fund important to me? Well, I have sickle cell. That's why I had a stroke. That's why I have a limp. I didn't hurt my knee playing ball. I had a stroke from sickle cell. And the Valerie Fund is a major supporter of sickle cell intervention in terms of research, treatment, and support. Now, the Goldsteins are, for me, a remarkable family, not because of the gift, but because of the kind of people they are. They lost both their daughters. No parent should outlive one child, least of all of their children. Many of us would be angry, melancholy, and withdrawn. But the Goldsteins, in many ways, pulled us into their extraordinary dream. How did they do that? They gave $5 million to our Cancer Institute to name the Breast Cancer Center after their daughter. And there are other gifts to come. And we recognize that healthcare disparities in cancer exist across the state of New Jersey. Joe Muscarelli, who is a member of the board of directors of the foundation of UMDNJ, made something that was striking, a large, unrestricted gift to the University Hospital. Joe Muscarelli, who is on the board of the foundation, who stood up and told his peers, I challenge you to match what I've done. That's striking. Now, I also want to remind you that we discover things at UMDNJ. We're in the top 15% of research universities for funding in the United States. In last week's Chronicle of Higher Education, we were 2 slots in that ranking below. What's a school here in New Jersey that has orange and black as a color? Princeton. 2 slots below. They better watch out. We're going to be passing Shirley Tillman in that group very soon. And sometimes our discovery of things, I want to point out to you, is just describing things in a different but very important way. Just last month, one of our faculty reported in the Journal of the American Medical Association a paradigm shift in the treatment for prostate cancer. Guess what? Some of us black men, and I'm waiting for my prostate cancer since my dad had it, my granddad had it. It is a disease that disproportionately affects men of color. Very often do better just by watchful waiting rather than the intervention. That's a major paradigm shift. That was why it was on the ABC Nightly News. Also on the ABC Nightly News, one of our faculty at the School of Osteopathic Medicine reported that the U.S. is losing ground rapidly in one of its key industries, the pharmaceutical industry. Right now, there is more discovery of new drugs in Europe than there is in the United States. That's scary with a double unemployment in much of the U.S. and us being in the pharmaceutical alley of America. But I'll tell you, we're also participating in healthcare reform. Dean Feldman at the New Jersey Dental School has gained national attention to the level of the White House by pointing out something kind of simple, healthcare reform. Guess what? Has to include oral health. And that being said, maybe some of these initiatives in information technology should include dental health. Until she called it out, it did not exist as an inclusion in healthcare reform. It is now in that. We've done very well in terms of the economic recovery. The American Recovery and Reinvestment Act of 2009. As you recall, there was $1 billion that was set aside for health information technology. The budget of the National Institutes of Health went up by 30%, $10 billion. Right now, this university is the leading university in the state of New Jersey for getting research funding from Obama's Recovery and Reinvestment Act. We've garnered $17 million to date, and that's wave one. Wave 2 and 3 are coming, and we're number 1, and I anticipate we're going to pull out even further away from other institutions. So that's just a small number of our accomplishments over the last year. As you've heard, I've been here 2 years. Shortly after I had arrived, I had a senior legislator from the state of New Jersey come to my office here on the Newark campus. He looked out the window. He turned to me and very seriously asked me if I thought the university was, quote, too big, end quote. And I'll tell you, as I try to, within the time constraints we have this morning, recite to you some of the accomplishments of this university and some of our audacious ambitions, and for me, audacious expectations as opposed to ambitions, and not be able to do so in that time, I really do wonder if the answer, yeah, maybe we are too big. But I'm ambivalent about that. Now, part of me says, well, we are too big because I didn't have time to tell you about the students' knitting program. Let me tell you about the students' knitting program. I'll cheat a little bit. Our students knit squares. They put the squares in a basket. They're shipped to Africa, to Central and Southern Africa, and the squares are sewn together to make a blanket. And who's the blanket for? Cold babies. You know, I didn't have time to tell you about our rapid screening test that was developed on this campus that resulted in the formation of a new company to diagnose drug-resistant tuberculosis, a scourge, a health scourge in the third world that you don't hear about. I didn't have time to tell you about the 2 million patient visits per year. I didn't have time to tell you about the hundreds of letters that I receive unsolicited from those patients, telling us not what was wrong with the care, but what was right with their care in this institution. I didn't have time to tell you about the challenged youngster who grew up here on the streets of Newark, who participated in one of Dean Johnson's early talent identification pipeline programs, who's now a student here, who is getting an MD, a PhD, and an MPH. I didn't tell you about, I can blankety, blankety, blank. So, at some level, maybe we are too big, and I'll tell you, I like us being too big. I like being braggadocious. I like sitting there with my colleagues at other universities who have not gone through the sort of negative advertising campaign that we've had for the last 3 to 4 years and telling them about the terrific stuff that we have. The more, the better for me. But let me return to the original query. And I told you I was ambivalent about the answer. Are we too big or are we not? You know, the flip side says to me that if we were too big, why would I know about Linda Groce, who was employed in our human resources organization on this campus for 40 years, who wrote me last month, and she said, quote, President Owen, I consider myself the chief cheerleader of UMDNJ during good and bad times. If we were too big, why would I know about Security Officer Kachima Johnson, who stayed in the Bergen building on the 14th floor during a fire? During a real fire. Everyone told to evacuate the building. Why is she sitting on the 14th floor? Because there was a staff member who was gait impaired and who could not come down the stairs. Kachima, who I said, Kachima, why'd you do it? And her response was, President Owen, I was only doing what was right. You know, if we were too big, why would I know about the initial iteration of this university's credo that was developed by a multidisciplinary team across the state? Serves as a living and breathing embodiment about what we should be, our shared values. That was so striking, it brought me to tears. And I can hardly wait to show to you. So on this occasion of reporting to the BCC, I think my response is we are not too big. I think we're too small. Too small in our thinking. Too small in pursuing our audacious ambitions. Too small in asking our supporters and detractors alike, come take a look at us closely. Too small in recognizing the great accomplishments that have occurred here, that you folks have helped to drive by accountability and goal setting. So I would say let us change. Let us change that starting today. And in conclusion, I want to remind you of a few things. Price of a mess of greens at our farmer's market, $10. Price of a hospital day at University Hospital, $5,000. Price of a 4-year education in New Jersey Medical School, $100,000. Price of UMDNJ as a state asset, priceless. Thank you, everyone.